Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Atrial flutter and atrial fibrillation are heart rhythm disorders that affect millions of people worldwide. They are also called arrhythmias, which means an irregular or abnormal heart rhythm. These conditions specifically impact the heart's upper chambers, known as the atria, which play a crucial role in the heart's function. In atrial flutter, the heart beats very fast, but in a regular pattern, which can sometimes be mistaken for a normal rhythm. In contrast, atrial fibrillation causes the heart to beat irregularly and often very fast, making it more unpredictable and harder to manage. These conditions are becoming increasingly common, especially among older adults and those with other heart conditions. If left untreated, they can lead to serious complications, including heart failure and other cardiovascular issues. This makes understanding atrial flutter and atrial fibrillation crucial for everyone, not just healthcare professionals. Atrial flutter and fibrillation can significantly increase the risk of stroke, which is a leading cause of disability and death. This is because the irregular heartbeat can cause blood to pool in the atria, creating an environment where clots can easily form. This pooling of blood can lead to the formation of blood clots, which are dangerous and potentially life-threatening. If a blood clot forms, it can travel through the bloodstream to the brain, causing severe complications. This can block blood flow and cause a stroke, which can have devastating effects on a person's health and quality of life. It's important to seek medical attention if you experience any symptoms of these conditions, such as palpitations, shortness of breath, or dizziness. Atrial flutter and atrial fibrillation occur due to problems with the heart's electrical system, which can be quite complex. The heart's electrical system controls the rhythm of your heartbeat, ensuring it beats in a coordinated manner. When this system malfunctions, it can cause the atria to beat too fast or irregularly, leading to serious health issues. Several factors can contribute to the development of these conditions, making it important to understand them. High blood pressure is a leading cause, often overlooked by many. Other risk factors include coronary artery disease, heart valve disease, and hyperthyroidism. Excessive alcohol consumption and sleep apnea can also contribute to atrial fibrillation, affecting overall heart health. In some cases, the exact cause of these conditions remains unknown, despite extensive research. Many people with atrial flutter or fibrillation don't experience any noticeable symptoms, making it difficult to diagnose without medical tests. When symptoms do occur, they can vary in severity and can sometimes be mistaken for other conditions. Some people may only experience mild palpitations, which can feel like a slight fluttering or racing heart. This sensation can be unsettling, but is often not painful. Others may experience more severe symptoms such as shortness of breath, fatigue, and dizziness, which can significantly impact daily activities. Chest pain is less common but can occur, and it is important to take it seriously. However, it can be a sign of a more serious problem and requires immediate medical attention to rule out conditions like a heart attack. It's important to remember that symptoms can be intermittent, appearing and disappearing over time. You may experience them for a short period and then they disappear, only to return later, making it crucial to monitor your health regularly. Section 4. Diagnosing atrial flutter and atrial fibrillation. Methods and procedures. Diagnosing atrial flutter and atrial fibrillation typically involves a combination of various tests. An electrocardiogram, or ECG, is the most common test used to diagnose these heart conditions. An ECG records the heart's electrical activity in detail. Your doctor may also recommend other diagnostic tests. These can include a Holter monitor, which is a portable ECG device worn for 24 hours or even longer. Another test is an echocardiogram, which uses sound waves to create detailed images of your heart. Section 5. Treatment options. Managing and treating atrial flutter and atrial fibrillation. The goals of treatment for atrial flutter and atrial fibrillation are to regulate the heart rhythm and ensure it stays within a normal range. Treatment also aims to prevent stroke, which is a serious complication, and manage symptoms to improve the patient's quality of life. Treatment options vary depending on the severity of the condition and the individual's overall health, including any other underlying medical issues. Medications are often the first line of treatment and can be very effective. These may include medications to control the heart rate, such as beta blockers, and prevent blood clots, like anticoagulants. In some cases, more invasive procedures may be necessary to correct the heart rhythm. These procedures include electrical cardioversion, which uses an electrical shock to reset the heart rhythm to its normal state. Another option is catheter ablation, which uses heat or cold energy to destroy the small areas of heart tissue that are causing the irregular heartbeat, thereby restoring normal rhythm. UMCC, your ultimate medical consultant connectors.